Podcast High Fidelity Clinical Simulation The Review. This podcast is intended for the facilitators who have completed the following training: High Fidelity Clinical Simulation at ESPA Montréal. Part 2 The Simulation. Let's first review the elements to integrate for each simulation. Each group of learners should have from 10 to 15 minutes to complete their scenario. It is imperative to never send a participant alone. Synchronous peer observation in the debriefing room will be possible. To maintain the attention of the non-active learners during the simulation, consider providing and explaining the active peer observation grid. This keeps everyone involved and provides constructive feedback material during the debriefing for the learners. Here are some key points to remember when, as a facilitator, you are playing the role of the simulated patient. In other words, you're doing the voice of the simulator. It is important that you know the scenario and the objectives of the simulation. We recommend that you are putting yourself in the shoes of a real patient. It is important to only be answering the question asked. You should also be accepting all learners' interventions without challenging or making them hesitate. This will give you material to discuss during the debriefing. It is also important to be consistent in the scenario between teams. To maintain a caring attitude towards learners, not to create unnecessary stress, it is possible to add elements to your scenario. You can add noises if the situation seems too easy for your learners, or add signals if the situation seems too complex and or not evolving. Please take note that it's only possible to do so after discussing with the simulation technician present in the room. Now, let's talk about some key points to remember about the role of the facilitator when the scenarios are carried out with a standardized patient. It is important to engage with the standardized patient to discuss the scenario during the briefing. The use of the walkie-talkie is important to guide the standardized patient during the scenario. You will have to oversee the sound console and the cameras. It is also possible to add elements to your scenario, noises if the situation is too easy, or signals if the situation seems too complex or not evolving for your learners after discussing with the standardized patient. We would like now to highlight some common pitfalls to avoid when conducting simulations to ensure a better experience for your learners. Not knowing the scenario or its goals. If you do not prepare well enough, it will be difficult to move the scenario forward based on the learner's intervention. Refusing an erroneous intervention. Instead, we recommend that you follow up on the intervention logically and take the opportunity to focus on understanding the performance gap during the debriefing. Saying, "Do something!" This type of intervention is quite stressful and may not lead to the desired outcome. The use of more realistic cues linked to the patient's case is desirable. On the other hand, giving too many cues, especially to the first group, is not a recommended practice. This intervention is often motivated by the desire to see the learner succeed. However, this practice can hinder the development of their clinical judgment and skills. It is therefore necessary to proceed progressively. Anticipating learners' questions by giving them answers before they ask for them. As with the previous intervention, this practice can hinder the development of learners' skills. Saying what a real patient wouldn't say or ask. For example, "My pulse oximeter isn't on," when learners seems to question the reason why the pulse oximetry result isn't displayed on the screen. Questioning the theory. This risk breaking realism and slowing down the progression of the scenario. Changing the scenario between groups. If the scenario script does not provide instructions for this kind of modification, it is advised to stick to the original scenario. Observation and note taking are an integral part of the facilitator's active role during the simulation. Here are some tips for making relevant observations and taking concise notes. Refer to the objectives. We recommend highlighting them beforehand. Respect the scenario. The simulation specialist who accompanies you in the control room can help you with this aspect. Observe performance gaps, in other words, errors. Expect the unexpected. Take notes on the good shots, the worse shots, the attitudes, the communication skills, and the teamwork. This sums up the simulation phase. We hope this will help you during your next simulation session. We'll be seeing you in the part 3 of this podcast where we'll review the debriefing phase. See you next.